USMLE style question. A 34-year-old woman presents with chronic diarrhea, weight loss, and fatigue for the past 6 months. She also reports bloating and foul-smelling stools that are difficult to flush. She has no history of recent travel, infections, or antibiotic use. Her past medical history is notable for iron deficiency anemia diagnosed 1 year ago. Physical examination reveals a scaly, pruritic rash with grouped vesicles on her elbows and knees. Laboratory studies show hemoglobin 10.2 gram villous low, mean corpuscular volume MCV 7,2-fephatorals microcytic, serum ferritin low, serum calcium low normal, vitamin D low. An upper endoscopic biopsy of the small intestine shows villous atrophy, crypt hyperplasia, and intraepithelial lymphocytes. Which of the following is the most likely diagnosis? A. Crohn's disease, Giardia infection. C. Lactose intolerance. D. Tropical sprue. E. Answer and explanation. Correct answer, E. Celiac disease. This patient presents with chronic diarrhea, steatorrhea, foul-smelling, difficult-to-flush stools, weight loss, iron deficiency anemia, and a pruritic rash, which is highly suggestive of celiac disease. Key features of celiac disease. Pathophysiology. Autoimmune reaction to gliadin, a gluten protein, leads to inflammation and villous atrophy in the distal duodenum and proximal jejunum, impairing nutrient absorption. Symptoms: diarrhea, steatorrhea, fat malabsorption, weight loss, bloating, fatigue due to vitamin nutrient deficiencies, iron deficiency anemia, absorption in the proximal small intestine, vitamin D deficiency leading to low calcium. Associated skin condition: dermatitis herpetiformis, pruritic, vesicular rash on extensor surfaces. Biopsy findings: villous atrophy, crypt hyperplasia, intraepithelial lymphocytes, serologic markers, anti-tissue transglutaminase, TTG, IgA, anti-endomysial antibodies. Treatment: gluten-free diet, avoiding wheat, barley, and rye. Why not the other choices? A. Crohn's disease can cause diarrhea and weight loss, but typically presents with bloody diarrhea, abdominal pain, and transmural inflammation, skip lesions, granulomas, rather than villous atrophy. Giardia infection causes watery diarrhea and malabsorption, but is acute or episodic, often linked to contaminated water exposure. Biopsy would show trophozoites, not villous atrophy. C. Lactose intolerance causes osmotic diarrhea and bloating, but does not cause weight loss, iron deficiency, or vitamin malabsorption. Tropical sprue, similar malabsorption symptoms, but occurs in patients with a history of recent tropical travel and responds to antibiotics. Takeaway: celiac disease is an autoimmune disorder triggered by gluten, leading to villous atrophy in the small intestine, malabsorption, and steatorrhea. It is associated with iron deficiency anemia, dermatitis herpetiformis, and anti-tTG antibodies. A gluten-free diet is the definitive treatment.